Yeah, Manoj, I have gone through many of your websites and figure out some products. So let's go product by product. Maybe you can give short liner how it helps the people. First one is a hospital CRM.
Yeah, so I mean, you would understand what a CRM
Yeah,
is. CRM is a customer relationship management tool. There are many CRMs in the market. Ours is a very specific healthcare focused CRM. So it's made for hospitals. Okay, and what it does is the AI piece is that it also is able to understand who's the customer, is able to bring up the customer information, is able to understand what's the customer intent, right? Is able to summarize what the call is about, okay, and to be able to come up with some action points for that particular customer. So if a customer calls and talks to an agent today, all of that recording is there, and then the AI picks up on all of that stuff and is able to make it actionable. Call the customer in 2 days, customer wants an appointment, customer is not happy, a bunch of things, right? And then you could subsequently analyze all of that information to figure out which kind of customers are more loyal, which kind of customers you can expect to get more business, and things like that.
yeah, maybe actionable items when a customer calls for a particular disease. Maybe AI can send an automatic video to that customer where which is there in the YouTube for a particular hospital. So I think these kind of things is also possible.
Yeah, so what we've done is we've integrated all the healthcare assets. So that you have your website, you have your WhatsApp. Okay, so we have actually an AI conversational AI chatbot. Okay, which is also one of the things is that your regular WhatsApp is you can ask some question. If it has a ready-made response, it'll respond. Otherwise, it'll ask you again.
Yeah,
Our conversational bot is able to understand what you're saying and is able to respond in kind. So let's say if I say that, where's the cafeteria in a hospital, it's able to tell you that. Okay. If I would, so when you say hello, it understands your complete history, is able to showcase what your past appointments are, what your future appointments are, whether you'd like to cancel it. Okay. You could say that, I don't feel like coming, and it understands that. Okay, I'm not able to come, is also understands that. You don't have to specifically say cancel, correct? Because it's a conversational bot and it understands subjects, and it learns from that. So that's what makes it unique. Okay, and you could even say that please book an appointment for me for a particular doctor or for diabetes doctor tomorrow morning 10 o'clock. He'll book that entire appointment for you with that one sentence,
yeah,
because it understands every part of the context, right? That's what makes it different from any other regular bot.
yeah. That's what, right? AI WhatsApp bot you are
Yes, that's
speaking
the
about.
conversational bot I was talking
Yeah, and AI ICD medical coding.
about. So today, a lot of, if you look at medical transcription, so
Yeah,
that's what they do, is that you get doctor's notes,
yeah.
and then you have all these
Everything is manual.
everything is manual.
Yeah,
So you need to look at the ICD codes, figure out what the doctor is talking about, put in those codes, because all of this is very important for those processing, insurance processing in the US and all of that. Solely, some of that concept is coming to India.
right.
So what this AI tool does is it takes all the notes and is able to translate and code everything automatically without somebody having to actually manually do that. So your medical coder tomorrow just has to review that coding and figure out whether it's right or not, and then sign off on it. It's as simple as that. So it kind of automates the entire process.
Yeah, I think it's very useful.
It's a very useful tool, yes.
AI telemedicine solutions.
Yeah, so telemedicine is online consultation, correct? We've been doing that for a large number of years now, more than 15 years. Okay, and what we've done is we've tried to incorporate some AI elements into that in terms of recognition, in terms of understanding the context, recording, being able to understand what has been discussed during that, translating that into text into multiple languages. Because one of the things AI is very good at is language translation, right? So we are using some of that stuff.
Yeah. AI preventive healthcare checkup.
Okay, so this is some of the new stuff which we're doing in conjunction with a partner, one of our clients. Okay, so you go for a preventive health checkup. It's able to action out. It's able to give you a score, risk score. It's able to also action out that this is the test which there are some, you're going over. Okay, this is the frequency by which you need to get tested and all of
Okay. And healthcare unified payment module.
that. So in this, for especially again for healthcare, we deal with large number of hospitals. So you could actually, it's a payments platform. Every hospital can have its own payment system, but it's unified into one single platform.
Okay. Hospital machine integration.
Um, every if you look at Indian hospitals, Middle East, anywhere, there are large number of machines, and all of these need to be integrated to be able to talk together. That's a manual process which happens, and we happen to be pretty good at that. So we've been doing that for some time.
Okay. And coming to Clinion EDC, how Clinion EDC augmented with AI is different from other EDC.
So
As you
Clinion,
already said that you are picking the data and making suggestions to the clinical data managers.
Clinion is an AI-enabled e-clinical platform. Clinion EDC is a pretty mature platform. It's been in the market for almost 12 years. We have done more than 650 clinical trials. Okay. At any point of time, we have over 140 studies running on our servers in the US, Europe, and India. We have more than 50 clients. What really differentiates Clinion from the competitors is that we have AI tools embedded in the platform and come as part of the platform. Okay. One is that we've got the largest number of AI tools compared to anyone else. Okay. The second thing is that the AI is part of the platform. So when you subscribe to the platform, you also get the AI inbuilt. Okay. It's not comes as a separate, doesn't come as a separate service. You don't have to pay extra money for some of the AI tools. Okay, it comes as part of the platform. That's a unique differentiator, because our vision is to provide an integrated end-to-end platform which accelerates clinical trials using AI.
Okay. And also your EDC is integrated with RTSM.
So our EDC and RTSM integration is a kind of a unique integration, because one is you can do randomization through the EDC, which most other platforms have. But what we can also do is that we can do kit assignment, reassignment, and returns to the EDC, which most other platforms do not have.
Right. Yeah. So that is one of the USP of your RTSM system.
Yes, very much so.
And about ECOA and EPRO.
ECOA is, again, now what we've seen is that as the FDA and the DCGI and most of the regulatory authorities are pushing for more real world data, real world evidence, we see a huge uptick in the number of EPRO studies or ECOA studies. Okay, so ECOA is essentially EPRO, e-consent, e-source, and our ePro is available on Android, iOS, and on the web. You could alternate between these systems.
Okay.
Easy, very fast to set up, multilingual. It comes as a standalone system or integrated with the EDC.
Okay, even it can be integrated with RTSM.
With the RTSM also as well.
And RTSM. So how you have implemented AI in RTSM?
Well, we haven't yet implemented AI in RTSM.
Okay.
We're in the process of doing so. One of the biggest challenges in RTSM is predictive, forecasting, inventory forecasting. Yeah. That's a challenge which we plan to take up, which we're in the process of figuring out how to do that using AI. We know AI can be used for that, but then again, like I said before, is that we need something which is dependable, predictable, right, robust. So easier said than done. We need to figure out the mathematical model first, because forecasting is a lot of maths, and then subsequently try and see how AI can do that.
Yeah, and also each study is unique, so you cannot depend on the previous study data to
forecast for this study.
Yeah.
Yes. Correct. Exactly.
Okay. And CTMS.
So CTMS takes care of the operations of clinical trial. It takes care of budgeting, monitoring, expense management, project management. Okay, it looks at all the bells and whistles of actually carrying out a clinical trial. So Clinion CTMS takes care of that.
Okay, and ETMF.
So ETMF is a document management system. Okay, and what we have is we have a online document management system which is integrated with the Clinion EDC. So EDC and CTMS documents flow into the ETMF. Okay, it's a document repository, and it's something which is required for large scale clinical trials.
Any AI implementation here?
Nothing in TMF right now.
TMS. Okay. Document automation.
Well, this is again a very new area. So, like I said before, is that AI is really good at documentation, and we're talking about generative AI. So, we have two tools in document automation. One is e-protocol generation and CSR automation. Okay. In e-protocol generation, what we do is we upload a protocol summary, and we're able to generate the entire protocol. So, your protocol summary is typically anywhere between 5 to 10 pages, and your protocol itself is about 100 pages. Okay. So we need to be able to flesh out from your summary. We should be able to flesh out the entire protocol, and that's what our e-protocol tool does. It runs on Transliterate templates and on ICH M11 templates. It takes those inputs, it takes those guidelines, and is able to generate it section by section. The entire process of generation is in one tool, so you could actually have multiple authors, you could have reviewers commenting in line, and final generation in the tool itself.
Okay. Yeah.
So CSR is again very similar. In CSR, it's a clinical study report. So what happens in this clinical study report is that you need to, once the study is done, all the data is analyzed, you need to be able to generate this clinical study report for submission to the FDA. So you can upload the protocol and the SAP and the TLFs. The CSR tool using AI gets the relevant data. It has a template, pulls the relevant data, changes the tense, generates the safety narratives, and is able to generate about 70 to 80% of the CSR automatically.
Good. Yeah. AI medical coding.
Medical coding is a part of EDC tool. Okay. And we do Medra and Houdini coding. That's for adverse events and convents.
Okay. Yeah. Okay. So, how AI is used here?
So, what we have is we encoded the Medra dictionary, and when somebody submits an adverse event term, it's called a verbatim. So, it could be cold fever, it could be cold and age, it could be any one of the various adverse events people experience during clinical trials. Then the system picks up that adverse events, searches for that in the medical dictionary, in the meta dictionary, makes a match and gives you the 5 best matches.
Okay.
So the coder can pick the best match from those.
Okay. Yeah, and eSource.
eSource is a tablet-based tools available at the site, where sites can enter data directly into the system, and that goes and sits in the EDC. So that's already source, data at source. So that's how an eSource is.
Okay. And eConsent.
eConsent, not available in India, or at least not accepted in a sense that most companies are wary of using eConsent in India, but it's something which is really taking off in the US. So it could be remote consent or on-site consent. So patients can actually use your mobile phones to give consent remotely, or they could come to the site. There's a tablet. It has the full ICF forms, informed consent forms. Patient goes through that, signs off digitally. Investigator signs off digitally, and your consent is done.
Any video and audio consent implemented?
Yeah, so both the ePro and the eConsent have teleconsultation modules, so video consultation. So video is, you can do a teleconsultation on the fly, and that is recorded and kept available for future purposes.
Any AI implementation here?
At this point of time, no. We plan to use AI in ePro, in which you could upload the forms, and that will generate the ePro application.
Okay.
Yeah.
Any product we have missed?
I think we've covered all the products, yes. We've done a very, very comprehensive research. Thank you very much.
Yeah, no problem.